really excited about an aspect of vaccination that is really important, which is really how employers can sort of set good policies to encourage vaccine uptake through conversations. That can happen sort of at the organizational level, but also sort of at the peer-to-peer level, which I think is really important as well. And I won't talk for too long. We'll leave a lot of room for questions. As Scott mentioned, I found this organization called 19 to 0, and in this group we have advised hundreds of companies and thousands of other organizations just around things like how to address vaccine hesitancy and how to build confidence in employee populations, amongst others. So can we go to the next slide? Yes. Real quick, we are Canada's largest not-for-profit coalition. We have a bunch of people from industry, but also public health and government and NGOs. And I think that network really is key, because I think that, everybody's sort of out there looking for the right information and the right approaches. Different organizations have different things to offer. Scott mentioned employers are a very trusted source of information, whereas governments may not necessarily be. And I think the more we have trusted voices, sharing accurate information, the better off we'll be. So next slide. Yeah, so this is it's only got a few words on it, but I think it's a really important framing, which is I think that a lot of people have concerns and hesitancy, whatever you want to call it, about vaccination. I think that's very normal. I think that when we see things like Omicron emerging and a lot of people getting breakthrough infection, people wonder why do we get the vaccine, or people get reinfected? Why do we get this vaccine? And I don't think that, this stems from ignorance. And I think a lot of this stems from, everybody I think wants to do what's in the best interest of their own health, and they believe they're doing that. And I think maybe one of the most important things is to start from a non-judgmental frame of mind. I think with the vaccination issue in the United States, and also to some extent in Canada, there's been a lot of polarization. And I know certainly a lot of people in the medical field, and which is kind of where I come from, they kind of get judgy, and I don't generally think that serve the goal. And so I think that this is a really important way to sort of view this issue, because a lot of people you talk to may not have been vaccinated, and I don't think that trying to do evil when they do such things. So maybe we can go to the next slide as well. And when we think about sort of what vaccine hesitancy is, I think that really it's best to think about it as a spectrum, right? So on the far left, we are sort of like, I'll take anything with full confidence, right? And there's people like that for sure. And then on the other end of the spectrum, people who absolutely no matter what you do, refuse to take a vaccination. And I think the portion of people in that category is not actually particularly high. Certainly for non-COVID vaccines, it's not particularly high. And then sort of everywhere in between is, people who sort of, want it more than others, a bit unsure, down to, people who tend to not want the vaccines, but are perhaps convincible. And it's been interesting because, even as the pediatric vaccine, so the 5 to 11-year-old vaccine has been rolled out across Canada and the US, a lot of my even physician friends, they have a lot of questions around whether or not they should immunize their kids. And so it's not just a thing, that doesn't make you an anti-vaxxer if you have questions about doing these things. And so I think it's really important to recognize these things do exist in a spectrum. Now, I'm going to go through later a lot of ways to sort of how to talk about vaccination. But I think that I did want to start with sort of the, just the employer's role in all of this, right? And so I think the employers have had to play a fairly large role during COVID, because I think that, they've had to educate their employees around COVID and vaccines. I think they've had to really develop policies around, shutting down work and then going back to work. And, this has happened through multiple ways. Some of them have to develop vaccination related policies. Actually, I think most organizations have some sort of policy around vaccination. And I think that, we're into this Omicron wave, which is third, fourth, fifth, who knows, some number wave. And I think that, I've seen a lot of employers do this really, really well and support their employees in a really good way. And of course, what employers end up doing has to sort of depend on the nature of the work, the nature of their sort of employee pool. But I think there are genuine or general principles that apply to sort of any organization, whether you're a big bank or you're a meat plant or you're a transportation company. And so I do want to sort of go through these things. And the first thing is really, I think, to really listen and understand the viewpoints of your employees. And by that I mean, I think whenever we think about how we engage in conversations, how we implement mandates, if we do that, or policies, I think knowing what your workforce is thinking about and what different segments of the workforce is thinking about is really key, because that'll begin to sort of inform like where you start with this, right? You could be in an organization where the vaccine uptake rate is only 30%, and in that situation, I think you probably need to do more of a push around vaccine education, and as opposed to one where the uptake is 80%. Anyways, and I think when it comes to sort of listening, like it's really important that we not have preconceived notions or our employees are thinking. You kind of want to like just get the best information from them as possible. I think the next piece really is to acknowledge and validate again what people are thinking, whether about vaccination or return to the office or any of those issues. Because even though I may disagree with you in terms of how safe or effective I think a vaccine is, it doesn't mean that I'm not going to acknowledge and validate your concerns or fears about taking a vaccine, or your fears. I may think coming back to the office is very safe right now, but certain employees may not, and I think that I'm not necessarily going to. It's really important to at least acknowledge the subjective experience that people have. And I think with these two, you can begin to craft policies that are tailored to specific employee needs and employee segment needs. The last thing I'll say is flexibility and reactivity has always sort of been key, as we sort of all had to experience this pandemic where we go through like up and down waves of lockdowns and non-lockdowns and masking and no masking. And so I think that, at a macro level, I think in organization leadership has to be flexible in how they need to respond to COVID. I think when it comes to, things like vaccination policies or return to office, the more flexibility you have, it's generally a good idea to be somewhat flexible. And I know in a place like Canada, there's a lot of organizations that put in hard vaccine mandates, but they've only done so after a fairly long period of time with sort of exemption processes and a lot of work to sort of address hesitancy when people need that. And I don't think that's very common in a lot of other places in the world. And so really a lot of this is around listening to what your employees are saying about COVID related issues, acknowledging them maybe if you disagree, and coming up with tailored, flexible approaches to sort of address them. And so that's we can move on, but this is like sort of like a general framework for employers to think about. I'll try to go quickly through this actually, but the next section is really just around how you might begin a conversation, with your peer about vaccination. And so, if you think about a conceptual framework for thinking about what drives vaccine uptake, I think that, the WHO has this framework, the 3 C's they call it, the C's in the middle, confidence, complacency, and convenience. And if you go to the next slide, I'll sort of explain this in a second in greater detail. And then there's some other C's they've added. Maybe I didn't put that in. Go back a slide then. Sorry about that. I thought I had something in between. But when it comes to what these 3 things mean, I'll start with, the absence or presence of these 3 factors, I think really drive a lot of uptake, or the biggest predictors of uptake, right? So start with convenience, very conceptually straightforward. And we use convenience really means access, right? So you can imagine that there's a lot of access to vaccination in downtown New York City, in Manhattan. And there's probably less access to vaccination in, I don't know, like rural Alaska. And so, I think that making the vaccines as available as possible, and that includes both, having it like present and close to employees or people, but it also involves having policies that enable employees to, take time off work to get vaccinated, or take time off work if they have side effects from the vaccine, or take time off work to, talk to their doctor if they have questions. And so it's more than just having the vaccine in a bunch of pharmacies. And this is something we saw a lot of sort of during the pandemic, and when it came to sort of uptake issues and more vulnerable populations. Complacency, I think, is another really interesting one. And that really is, how worried are you about COVID, right? And so I think that generally speaking, if if you know a lot of people around you have died of COVID, or you see really high case counts, then people tend to be more inclined to get vaccinated. I mean, there are a lot of exceptions to this, but on average, and we sort of like even at a country level, you would have seen like places like New Zealand and Australia, Hong Kong that had really good COVID control, had pretty low vaccine uptake for a long time, actually. And I think seeing something in front of you that's causing harm is more likely to get you to do something about it. And then the last is confidence, which I think, we traditionally think of as like vaccine hesitance. Do I think it's safe? Do I think it's not safe? But a lot of this is underpinned actually by how much we trust our sort of institutions like government, public health, et cetera, et cetera. And I think that's why we tend to see a pretty big split actually between blue states and red states. To a lesser extent, this happens in Canada, where you see a bit of a split between people who are more right of center, more left of center. And this isn't like, this is not a political attack in any way. It's just like at the end of the day, nobody, including myself, including Scott, who knows a lot more than I do, can know everything about vaccines, right? And so I tend to trust regulators like Health Canada or the FDA, but others who don't trust public health as much or government as much, and lots of reasons not to trust government, may not. And so it's really these three factors that when I think about like how do I increase vaccine uptake in a particular population, I try to boost, confidence, try to minimize complacency, and try to, optimize the convenience point. So anyways, now we can move on. Thank you. So this part I think is hopefully, like pretty common sense stuff, but just some general principles about how to speak to colleagues or peers, your friends, family, really anybody, about vaccination, right? And so 4 points. One, the messenger is very, very important. And by that, I mean, it is probably better that somebody with no medical training at all, that like you trust, like that somebody is spoken to by somebody with no medical training they trust, than somebody with, a lot of medical background. So I'll show some slides on that, but like who speaks is super, super important. You want to connect before you communicate, and show some genuine curiosity and concern. And so this links back to the opposite of what I was saying: judgment, bad. On the other end of that spectrum is genuine concern and apathy and validation of their worries and their fears. And then lastly, you want to keep it personal, you want to keep it anecdotal, etc. So we can just go to the next slide. Yeah, so I think that when I say the messenger is often more important than the message itself. So a lot of people really do trust if you look in the left, doctor, nurse, or pharmacist, and people tend to not really trust celebrities as much. And then that's why like big scale influencer campaigns don't work. But when it comes to, how I would think about communicating to people, so sure, people trust their physician. That's great. But people often trust their pastor or their employer, or their, the person they go to, scouts with. And I think that, I think that this is why we can't just rely on healthcare workers to spread the message, because different people trust different people, and the more trusted voices there are, the better things sort of become. Like, when we've done work in rural areas, in any sort of area where there's sort of low confidence, low trust in government, we always try to engage local champions, not like, yes, healthcare workers, but also sort of local community leaders. Okay, next. I feel like I'm rambling on. We can go quickly. In terms of sort of how to build a connection with somebody. And, I presume that a lot of the people you're going to be talking to potentially, or, like you're recommending employees talk to people they already know. And that's like, you're already starting from a good place because there's already some innate trust there. But I mean, I think that, when it comes to these things, you want to sort of get to know the person, their history a little bit, validate their emotion. If they say, like, I really don't want to get vaccinated because one of my friends who got vaccine had a crazy allergic reaction, ended up in hospital. So you want to sort of be empathetic with that, listen to what they're saying. And then, you may want to bring in your own stories, for example. I mean, I think statistics are one thing, but people often at this level make great, like they make conversation around, like stories. Like, like example of a good story would be, my parents were in a long-term nursing home, and I saw so many people passing away. I was quite worried, but then it got vaccinated, and I saw cases, number of deaths, go down a lot, and I was really, really relieved. And so, anyways, I think everybody does have, hopefully at this point, some stories around immunization, COVID, and whatnot. Next slide. Yeah. Yes, I mean, more of this stuff, but don't be judgmental. I do think focusing on the personal benefit is very important. And by that, I mean, on average, I think people respond more. We often talk about like the collective good vaccination does, or the collective return to normal these things do. But I think for a lot of people, and it depends who you're asking, depends what surveys you do, but like how it affects, it's like does this help me? Does this help my child? Does this hurt my child? So personal benefit is important. And then, you do want to directly address things that people are asking about, like, like, does this thing cause myocarditis or whatever, and not sort of brush those under the table if they do come up. Next slide. Um, yeah, I think that, and something I've also been saying before is that, you kind of, remember like the key message we're trying to communicate. People do make decisions. I can show lots of numbers, but you don't want to make them overly complex. Like an example of message would be like, even though people are getting, like Omicron, the vaccines reduce your risk of death by, almost like not, let's say 95% or something. And so I think you do want to keep it simple. You want to tie it in sort of with stories. Go to the next slide. Oh, yes. And this is like a little framework that we came up with. But I feel like I've talked a lot about how to talk about vaccination. And so, if I were to really just summarize what I said, it would be a few things. One, do not be judgmental and be empathetic and understand where people are coming from. Two, build a connection. Really important, and be empathetic. Three, share stories and anecdotes if you can. And I don't think that every conversation will lead to somebody who wasn't going to get vaccinated to be vaccinated. But people are having like lots of conversations, and they're getting lots of sort of information on this every day from the news and from their WhatsApp groups and whatnot. And so I think a positive conversation in this direction can go a long way in helping somebody to be vaccinated, especially if they trust you. And I think that as employees on average trust you. And like if we're talking about peers, then you probably talk to people you kind of trust who trust you. And so I'll stop here actually.